Well, hello, everybody. It's Mark and Ann with CareQuest Solutions with another live episode. And we're actually having Kathy come back with part two. So tell us a little bit about Kathy, Ann, what we're going to be talking about.
So we have Kathy Halpin. I have to say this right. So, and Kathy has been a seasoned insurance professional for over 23 years. So today we're going to talk a little bit about crazy. I don't know. I'm sorry, y'all. I don't know why I had a crazy minute there. My phone hit the live button and it started playing. Anyway, I apologize. Kathy's going to talk with us though for all the crazy stuff going on in healthcare for open enrollment. There's a lot of things to watch for. So she's going to cover some of that for us today.
Sounds good. Well, let's count this down and get Kathy in here and we'll launch this show.
Okay.
Well, we have Kathy Halpin part two. Ain't that right, Kathy?
That is right. Hello, y'all. Hey. How's
Hey.
it going?
Good to have you back. And are you ready for this wonderful Thanksgiving Day coming up?
I am. I have on my my turkey earrings.
Turkey earrings.
Aww.
I can get those in the picture.
Now, knowing you, I'm surprised you're not in a turkey costume.
You know what, Mark? I couldn't get one here in time.
Yeah.
I looked. I did look. And so we're going to my sister's house for Thanksgiving, and there's going to be a bunch of people. She opens up her home. And so there's going to be a bunch of people there. And I thought, how funny would it be to get some inflatable turkey costumes and have the races? So I couldn't get them here in time. I had to cancel my order after I placed them. I'm like, oh, gosh, I don't want these on December the 9th. But I do have inflatable dragons that we will.
Oh, yeah.
Yeah.
Well,
that'll be fun.
When I first met Kathy, it was at the Rotary, and she actually had a red, white, and blue flag outfit on, and titled her name Miss America. So I guess if you were a turkey, you just had to be Turkey American or something, right?
But I do have on my Simply Blessed shirt. So I do have on a kind of little Thanksgiving motif going on. I'm very thankful every day, not just during the holidays. So
Good deal.
I like to be grateful for every single day. So it's fun. It's good to be good to be back, and I'm glad to be here.
Well, glad you're here with Ann and myself. And so I tell you what, just give a little recap, tell everybody a little bit about yourself, and I'll let Ann take off with some questions after that.
So, hey, y'all, it's good to see everybody. My name is Kathy Halpin, owner and CEO of BeneTrend Partners, insurance agency located in Peachtree City. We specialize in small group, large group. We focus on employee benefits for kind of all sizes. We help a small business down to two, husband, wife. And we like to promote healthcare like a sandwich. So we've created the BeneTrend sandwich. And so that allows individuals, 1099 contractors, small businesses, large businesses. And right now it's open enrollment time. So everybody's kind of focused on the medical, but that benefits sandwich allows people to have basically what a Fortune 500 company has. And people don't realize that. And these are benefits that you can enroll in any time. But, right now it is open enrollment for 64 under, 65 over. What we're talking about today is 64 and under. So it's open enrollment. Okay. It started November 1st. It's going to close January the 15th. But if people want a January 1st effective date, they have to enroll by December the 15th. If after they miss that deadline, their next deadline would be that January 15th, and the effective date would be February the 1st. So just some kind of things that I wanted to share to just kind of educate, the audience on what to look for when they are going, if they don't have access to an employer benefit or spousal benefits or their parents' benefits, what do they do? So this is the time of the year. Georgia, for the first time, is pulled off of healthcare.gov. So in the past, Individuals needed to go to healthcare.gov to go navigate their healthcare.
Right.
This year they've pulled it off, and it's called, well, now Georgians are going through Georgia Access. Georgia Access has got, for our counties, and actually for the whole entire state of Georgia, we have 9 carriers on Georgia Access. That sounds great.
Okay.
But you kind of want to know what carrier is working and how to navigate.
Yeah.
There's people out there with medications. There's people out there with doctor relationships. So with pulling off of healthcare.gov, Georgia is saving $14 million a month. So there are, a lot of money by pulling off and going to our own state-based exchange.
Okay.
So with that, there's new calculations and enhanced subsidies. So subsidies are also called tax credits, also called premium assistance, all these words out there to confuse everybody. And so that's why income is so important. Like, what is eligible for income? Alimony. Alimony depends on if your divorces and separations finalized before January 1st, 2019, they include as income. But for after January 1st, 2019, they don't include as income. So there's people are getting into short-term rentals. They think that they can pocket that money. That is income. So that income that household income is based off of what you're eligible for a subsidy. And if you claim too little, you're going to get too much and you got to pay it back. And
so I'm sorry, not to interrupt, but just thinking through, because I know from, my world was nursing home. That's what I did all these years. But in dealing with nursing home, we dealt with Medicaid apps and all those kind of things. And so I've been on their websites. So how easy is this website for people how easy is this portal for them to navigate? Is this something crazy like most of the stuff that you have to navigate?
No, it's not. It's not crazy. Actually, I'm a member of the National Association of Business Insurance Professionals. It's a mouthful. We call it NABIP. So I sat in on 3 town hall back-end panels with NABIP and Georgia Access. And Georgia Access worked very closely with NABIP because they wanted the system not to be like healthcare.gov. Healthcare.gov system can take 20-25 minutes for an enrollment. It shouldn't take that long. Georgia Access, I've been planning in it when enrolling people since November the 1st. It's very easy. It's like, okay, what's your zip code? What's your date of birth? Do you have a spouse? Add that spouse, put that in date of birth. They smoker, non-smoker? Do they need coverage? Then it asks for that household income. And then it'll generate very quickly if you're eligible for a subsidy or not. So going in what you're eligible for a subsidy.
Okay.
And then you can put in up to 5 doctors. You can put it up to 5 prescriptions. On the prescriptions, you want to be very specific. Like I'm getting, medications of Lisoprol. And so is it 5 milligrams? Is it 20 milligrams? Everything needs to be kind of ticked off on the right box because everything's kind of syncing to each other. And then you go to these 9 carriers and then you have X's next to 4 of them because those providers aren't covered. The medication's not covered. And then you're going to see something that says, oh, you're going to get healthcare for free. You're going to see a big old goose egg. It says 0 free. Well, 0 is not always a hero.
Let me throw a lasso out there and rein it in some because this took off in 5 different directions and my brain is like about to pop. So going back, you mentioned the sandwich, the BeneTrend sandwich. So if anybody wants to go and look at the last episode, we covered that entire sandwich. So they can go back and review that episode and they'll understand what you're talking about on the sandwich. So that is fully covered. So with this being open enrollment, there's so many categories going on. So let's start with someone that needs to call you and inquire from scratch. They don't know a thing about it. They just know they're supposed to do something before it's too late. So what would that be like? Someone calls you up. What will the process be? And is there a charge for it? And how does all that work?
There is no charge. So when you call up, we're going to either myself or Ashley, somebody who answers the phone, is going to ask you some questions. Name, what's your date of birth? What county do you live in? What's your zip code? Are you a smoker or non-smoker? Who all needs coverage? We'll need dates of birth and gender for all of those people. It gets personal. What's your household income? That's a very personal question.
Yeah.
And people are like, but I have to know that to uncover the stone to see if they're eligible for any premium assistance. You know, our Affordable Care Act, I can tell y'all, there is nothing affordable about our healthcare coverage.
No.
Right.
And you know, the thing is, when they call, and that's something I want people to understand, is when they call and tell you their income, because we've had to do that on our end about, we have to know income, we have to know assets for Medicaid stuff and all that. But we would ask those questions and people were so resistive. And I can promise you, we ask enough people that the minute you walked out that door, I do not remember what your income was.
Yeah.
And I don't remember your bank account. And I don't know any of that information.
Yeah.
So just have, but they need to kind of have their ducks in a row, even when they call you, to have all this information.
Yep.
So, I mean, Mark, good point. Where to start with it.
Yeah. And isn't it true that when you're asking even the questions about your zip code, because the plans are different depending on the zip code you're in.
Zip code, county.
Yeah. And the income is not like you're applying for a mortgage. No, that helps open up what plans you are or are not available for. And if you don't answer that correctly, then you can come back and bite you, because they do, like Ann said, if it gets to a situation to where something happens and you have to go into, you know, a nursing home or skilled nursing because you can't afford private pay, assisted living, or memory care, those things will come into play.
Yep.
You know, and that's where you're calling Ann, her being background in the nursing home, those questions have to be answered to see if the coverage you have will pay for the care you need in the nursing home or skilled nursing. And if it's not done right, you're going to find out you're in a very big pickle, and it's going to be after the fact, and it's going to be a lot more stress. So it's best just to get it all out of the way at the beginning. Make sure you got the right plan for your needs today, and have it. How often should someone review it? Because, you know, our health changes, circumstances change. So how often can they review the plan, or is it just a season like this during open enrollment?
It's just a season like this during open enrollment, the opportunity to make any changes. You know, if somebody is, you know, let's just say they're making $50,000 and they say, well, how do I know what to say? Because it is based off of what you think you're making for 2025. It's not last year's. So so it's a very, you know, it's a kind of a guesstimate. And so I say, look at line 11 on your taxes from last year. People must have filed taxes to be eligible to get a subsidy. So people that haven't filed taxes, they're not eligible for a subsidy. They can still go get the plan and they're going to pay full price, but they're only going to be able to review kind of like their plan choice, this opportunity, open enrollment. And then if they have anything, like if they were to win the lottery, they got to call Georgia Access and said, hey, I just won $1 million. I don't need that subsidy anymore. And if they don't, and they're getting the subsidy,
they'll call back.
The dots are going to connect and the T's are going to cross. And then you're going to get that, you know, that letter in the mail, and you're going to owe back the money.
Yeah.
So in looking at, I know zip codes and counties and all that can be different on who's got what coverage and all those kind of things. So when you mentioned that they can have, just like a big corporation has, group insurance kind of thing. And so they have all these things they offer in that. And so they can get that through talking with you guys in the benefit sandwich and looking at what they want to put in and don't want to put in and those kind of things. But you also mentioned that nothing under Affordable Care Act is really affordable. And I know insurance is outrageous. So do the premiums fluctuate county to county? Are the premiums kind of the same just with the company that they're with? And what are we really talking about for a basic insurance policy? What kind of premiums are we looking at for people with that? Because you're talking about people that are really self-employed. A lot of people, when you're talking 1099s and those kind of things, which I think it's wonderful, because I can remember, unfortunately, this is, you know, natural. And I can remember back when this was not something that 1099, you know, self-employed, you could really count on getting.
Well,
you know,
along with what Ann's saying, I have a question that came up, because when you were asking about income and that being what's projected. So obviously being self-employed, depending on what stage you're at as a company, it could be anywhere from being broke to where I can make 500,000 next year, because it depends on, you're at that crossroads in business to where you're either going to break through or maybe you're not, and you're going to have to go and reassess things. How would you suggest someone answering that question when it's a loaded question?
It is a loaded question. And again, it's a projection. If you're broke, you're not going to get any subsidy. You're going to be directed to Medicaid.
Okay.
Right?
Yeah.
Yeah. Because you have to have some income.
You
You have to have a pulse.
You got to have a pulse. Exactly. And to answer your question, so I looked into when Georgia when it opened, I'm 53. My most affordable plan this year for me was, I want to say $716, which was cheaper than last year's plan. Last year's plan was $880
a month.
Yeah.
Well, but look, I'm not, that doesn't shock me, because even in working for nursing home groups all these years and stuff, I've had groups where, of course, years ago it was nothing, and they paid our insurance, administrator's insurance and things like that, but they quit doing that. But I've had it be $600 a month, easy, just to cover my husband and I.
Sure.
Yeah.
Sure.
Two of us. So yeah.
Do you have any knowledge of health share plans, Kathy?
MediShare?
No, just health share, like Liberty Health Share.
Absolutely. Yeah. The insurance that I'm kind of on is called Redirect, and it's kind of like a health share plan.
Yeah, I'm on Liberty Health Share, and it's
Liberty.
it's a good option for self-employment.
Absolutely.
As well. It's a different beast, but it's a way to be affordable, and you can adjust your plans to where, obviously, I look at things always being self-employed. There's been times when the plate was full and fat, and so I'd have the Cadillac plans to almost have no deductible, to where if an emergency came along, it's not going to wipe you out. But then having a situation with Liberty Health Share, it gives you the ability to where, you're going to have, to get a lower premium, you're going to have a higher deductible of the share, but it's still better than catastrophic getting wiped out by something. So
absolutely.
Yeah.
Absolutely. Absolutely.
Yeah.
And the Georgia Access for the, people that are self-employed, we can write a lot of things off, and we're kind of able to kind of keep our income at certain numbers. So again, as long as, and now you do have to, when you say that you're making this amount, you do have to submit documentation showing that you're making this amount. And then, Ann, back to your question, it's how are the premiums kind of gauged, and it's off of age and gender. And it's more of that than are you a smoker or a non-smoker? And our metals, they're sold in the metal level. So you have a bronze, a silver, and a gold. So when you're navigating this market, people need to know that the bronze, like you said, Mark, high deductible, low premium. These plans do not generally have copays. So they have to pay that deductible before they have any kind of coverage whatsoever. The silver plan gives us kind of warm fuzzies. People like warm fuzzies of copays. It gives them, I know it's going to cost me $45 to go to the doctor. Right. And then, your deductible is going down. Your gold plan, you're going to spend more, but you're going to spend less at the doctor. So if you have somebody that's sick going to the doctor, if you have a medical condition and you're in the individual market, you need a gold plan. You don't want a bronze plan.
Well, this is getting way off in the woods here, but it's worth mentioning, because I think people need to start paying more attention to taking care of themselves, because we're in such a heavily prescribed society that a lot of the things can be remedied by changing your lifestyle. So I just want to, that's a show by itself. But I sit there and you think about just the number of prescriptions some people are on, you're going, good Lord.
But, that really hasn't changed that much, Mark, because having been in the workforce, not like you, self-employed, because you've been on one side, I've been on the other.
Right.
Having been in the workforce all these years, I can remember back when the companies themselves were offering, because the insurance company was offering, do you have any employees that will join this health
initiative
benefit?
Wellness.
an
Yeah.
initiative. So that, I mean, we even did one just among ourselves where, we did different incentives where if you did so many miles in a month, then you could get your miles on a treadmill, on a bike, walking, whatever you did, honor system. But among ourselves, but even things like that, because encouraging people to quit smoking. I mean, I can remember back, gosh, coming into healthcare even 30 years ago, that being a big initiative with some of the health plans to get people to become healthier, because, these companies that are doing group plans, they're paying in a portion.
Yeah. Right.
So depending on how much they're paying in directly affects what the employees have to pay as a premium.
So, okay. So I think you answered what I was going to ask, Ann. So the company would say we contribute X amount a month towards this plan. So say it's the gold, silver, bronze, right, Kathy? So if the company goes, we will contribute the bronze amount, but if you want to go higher, then you pay the difference.
Oh yeah, absolutely.
Yeah.
Yeah. And then I like Ann's, those wellness types of things. Those are great for, not just encouraging, like you said, and, the encouragement, but it's good for camaraderie. It's good for the culture, especially if it's bought from the top up. And then that CEO basically is going to get a return on their investment. It might take 3 years. Usually takes about 3 years for them to see, because it goes back to what you said, Mark, the lifestyle. What are you doing?
Yeah.
Are you walking those, miles? Are you doing those types of things? I could go on and on, about, our navigating our healthcare. It's crazy. But it's, I love what you guys are doing as far as just, letting people know how to navigate it, educating people on what's out there, from all the different aspects, from the wellness to the 65 plus, 64 under. And one thing I forgot to mention, when you are navigating the healthcare, and I'm happy to help anybody, but you want to put in your doctor's names and you want to put in those pharmacy names. Well, I said that. Okay, never mind. Sorry.
But what if you don't have a doctor?
No,
like what if you don't have a doctor? Because I don't have a doctor.
Well, if you don't have a doctor, then you
have on you.
Well, if you don't have a doctor, you should.
I don't go to the doctor. I'm almost
really.
I'd almost have to. I do the old school, like, when the mule gets old and tired, you put a bullet in the chamber and take them out in the pasture. I'm like,
well, that's not good. We want to get you well. I do go for my wellness stuff, but that's, other than that, I use telemedicine for pretty much my needs, because thank goodness I'm healthy. And so I'm grateful for that. But what I wanted to say was on the carriers, when people are selecting, like when you see that 0, there are 9 carriers in the Georgia Access. 3 are paid out on Medicaid premiums. So what's happening in Fayette County and surrounding areas are people are paying for premiums and they cannot find a doctor to go to. And if they find a doctor, that is not accepting new patients. Yes. So Anthem and Better and CareSource are all paid out on Medicaid premiums. Yes. All 3 of these are going to be your most affordable carriers every single time. Their insurance carriers are rated by 5 stars. I found this interesting that only one has a 5-star rating, and it's Kaiser. So if you don't have a doctor, that's who you'd probably want to go to, is Kaiser. They got the best rating. But I like Aetna, Cigna, and Oscar and United Healthcare. Those seem to be working for individuals.
Those guys seem to be working really. Those are the ones that I would say, even if we flipped over and talked about, because you can't not talk about Medicare a little bit too, in all of this, but even if you're looking at managed care, which I call managed care and it's called Advantage Care, but I'm sorry, my world's hard for me to change up lingo and all that. But when you're talking about that on that side too, some of those guys are the big guys with the supplements and the Advantage plans and those kind of things. And they really carry it, because there are, I would say, certainly a higher percentage of physician practices that do not take a Medicaid. Right. You've even got some that don't want to take Medicare because of the filing and that kind of thing. But
in the billing, they might be set up
Medicaid
for the billing of it all, right?
Yeah.
Those carriers are coming up with the big 0 goose egg, and people are like, well, I want free healthcare. And that's why I say 0 is not the hero. They need to know what they're signing up for.
Yeah.
Those Medicaid carriers, they can be tricky. If they're working for them, that's great. But signing up for something new at this point, I'm a little leery of it. I just like to, that's just me.
Well, and I think at the end of the day, the important thing that I want people to hear too, and this is not, I'm not, no offense, I'm not trying to just plug you, but I'm going to plug you because they need to pick up the phone and call somebody like you and let you help them navigate this system. Because even though you may think, oh, I'm computer savvy and I can do this, insurance is a different animal because healthcare is a different animal. It just is.
It is.
So having someone like yourself, and I'm really thankful that you guys exist. Because I hate dealing with all that stuff. My kids will still call me and say, "Hey, Mom," and ask me questions. But yeah, it's a lot to really take in and understand. It really is.
Yeah.
It is.
Well, Kathy, is there anything else you'd like to add before we go out? Because I know we could probably talk for 10 hours on all this stuff and still not scratch the surface.
I know.
No. It's kind of coming up to the end of the year. So people with your FSAs and your HRAs, use your dollars. Don't lose your dollars. Some of them will roll over. HSA or individual accounts, but just be mindful coming up to the end of the year. If you have those accounts, don't leave any money on the table.
Very good.
Because all of them don't roll. Yeah, all of them don't roll. You have to know.
Not all of them roll over. Not all of it rolls
Yeah.
over. So you want to use those dollars. So
Yeah.
Absolutely.
I could talk for hours, and I haven't seen you in a while, Mark, but miss you and it was
I appreciate it. I'm going to weasel my way back to the Rotary meetings. It's been crazy season.
I know it's
getting
been
over
busy
there.
season over here too.
Yeah, all these little Rotarians, y'all all. The
gotta get you in, Ann.
only Rotarian stuff that I do is on the beach, and I'm going to.
You could be Rotarian in
I
the
can
mountains.
Rotarian with you on the beach too, and
That's
I would love
right.
to do that.
We can go do
Absolutely.
that. I'm open all day long.
Yeah. Well, Kathy, again, thanks for joining Ann and myself
y'all.
here
I appreciate
on
y'all
this.
so
And
much.
anybody wants to reach out to Kathy, of course, BeneTrend partner. She's easy to find. She is in the Peachtree City, Fayetteville area, but you can cover really anywhere in Georgia, right?
We're in Georgia. Yeah, for
long as you're in
2025,
Georgia.
I'll be going out in the broad open, but for right now, just in Georgia.
Absolutely. Well, we wish everybody a very happy, safe Thanksgiving.
Absolutely.
And take a break, relax, and enjoy Thanksgiving. And
Yes.
All right.
Yes.
kind of sit back and enjoy the moment. We get all caught up in life and it gets overwhelming. So time to take a pause, take a break, and be thankful. I'm thankful for Ann being co-host of the show. I'm thankful for Kathy joining us once again. And so with that said, it's Mark and Ann signing off, and we will catch everybody on the next show.
Bye, guys. Happy Thanksgiving.